From a marketing perspective and thinking about our stakeholders here at Intuitive, there are multiple of them. The first one are our patients, of course. They are who we make the product for, right? The value that's for them is getting better outcomes, doing it less invasively. I mean, I think that's clear. And then second to that are the surgeons. And then behind them is a big tier of folks who are really responsible for kind of the cost analysis, if you will, of our technology. So when you look at it, this might be the administrators of hospitals, government agencies, regulatory agencies, that set of stakeholders. And then behind them are our employees, certainly, and then ultimately our shareholders that own the company. So out of that group of folks, the decision makers behind it are kind of, you have to think about it, I think, a couple of ways. One is the decision to use Da Vinci in an operation, if you will, really comes down to the patient and surgeon. And ultimately, that's what's driving our business, is the use of Da Vinci every day. And then it's, how is it purchased, right? How is it acquired so that it's available to the surgeon to use in patients? And that comes down to the hospital administration trying to understand whether or not there's going to be a return on the investment. And that is, how much does it cost and how much is it reimbursed? And so in our case, and the reimbursement side is obviously on the regulatory governmental front. How much it costs is an interaction between our sales team and the local institution, whoever's trying to purchase the equipment. And so I think those are the primary influencers, if you will, on the use and the acquisition of the system. So the value propositions across that suite of stakeholders, it varies obviously to each one. But if you think about patients, ultimately it comes down to, I want great outcomes and I want the least amount of invasiveness in obtaining that outcome, right? So we have this equation, if you will, that we walk around with that says patient value. Their value in our technology is efficacy, the outcome of the operation, divided by invasiveness. So increase effectiveness, decrease invasiveness, and that's better patient value. So that, again, is our first and our primary value in driving the company forward. Surgeons, I think it's about a little bit more about the technology. Is it reliable? Can they learn it easily? Can they concentrate on the patient versus on the technology? Do we have a support system in place that's timely in terms of our sales rep coverage, our ability to get them trained in new procedures, the new products they need to advance their operations? So that's the world of surgeons, different than the patients, of course. And then when you look at the stakeholders who are financially oriented, right, the hospital administration, government agencies, it comes down to more about value. So now you're looking at, okay, I'm providing something different to the patient in our case, and the surgeon's delivering a minimally invasive operation. So it may get them reduced complications. It may get them out of the hospital more quickly. So that's going to come at a cost of acquiring and using our system. And so for them, it's that analysis that matters so much, is there going to be a return on the investment into robotics in our case? And so we help them with that. There are papers out there that show here are the clinical outcomes. There are their own analyses that say, hey, this is how much it costs. These are how many more patients I can bring in. This is how many more patients I can operate on because I can get them out more quickly. It's a complex analysis. And in some cases, in fact, they look actually outside the hospital, if you will, and into the societal impact. So how fast are people getting back to work? Do I have to pay them in say, in a socialized medicine model? Do I have to pay them for the time they're off of work? Well, in Sweden, for instance, in our technology, it got somebody back to work in 11 days versus 49 days with the open operation. So the government likes that, and they incent that. And then behind that are employees, again, very different, right? So the employees want a great place to work. You want a team around them that they can believe in and are engaged with, want great benefits. They want a mission that matters, in our case. And then the shareholders kind of are the caboose of this whole thing, and they benefit when all those other things go well.